whether my voice and video is audible and visible to you. Yes, perfect. So let's get started right now, guys. So yesterday we were discussing regarding heading topic right now. Let's begin. Yeah, let's continue our topic right now, guys. So yesterday we were discussing regarding the cranial foramens and the structure passing. Yes, guys, in this diagram we have discussed yesterday about the cranial foramens and the structures passing. Now, guys, yesterday we were actually studying about the head and neck part. In head and neck part, we have completed the cranial foramens and all. And then after completing this, we have actually studied about the muscles of mastication. There are totally 4 muscles of mastication: the masseter, the temporalis, and then the lateral pterygoid and the medial pterygoid. These are the 4 muscles of mastication we have discussed yesterday. And after that, now today we are going to study about the first topic, that is our tongue. Let us discuss about the tongue topic right now. Okay. And in this, first of all, we are going to do some one. There will be muscles inside the tongue. So you'll be having intrinsic muscles, and then you'll be having the muscles outside the tongue, that will be extrinsic muscles. So there will be intrinsic muscles and then there will be extrinsic muscles. You'll be having like 4 pairs of intrinsic muscles and you'll be having like 4 pairs of extrinsic muscles, guys. Now, what are the 4 pairs of intrinsic muscles inside the tongue? It's like damn easy, guys. Look at me here right now. If this is the tongue here right now, you just need to remember the directions right now, guys. Okay, there will be certain muscles along the length of the tongue, longitudinal, superior longitudinal, and then there will be inferior longitudinal. And there are certain muscles which are transverse muscle, guys, and then we'll be having the vertical muscle. The superior longitudinal, inferior longitudinal, then the transverse muscle and the vertical muscle. So the name of the muscle itself is, we can remember with the help of direction, guys. So remember, write down there, number 1, superior longitudinal muscle, and then number 2, you'll be having inferior longitudinal muscle, and then number 3, you'll be having transverse muscle, and number 4, you'll be having the vertical muscle. So there will be superior longitudinal muscle, and then there will be inferior longitudinal muscle, then you'll be having the transverse muscle, and then you'll be having the vertical muscle. Is it okay? So intrinsic muscles which are present inside the tongue, intrinsic muscles are divided into 4 categories. There are superior longitudinal, inferior longitudinal, then the transverse muscle and the vertical muscle. So once you are done with these 4 intrinsic muscles, guys, now welcome to the extrinsic muscles right now. Okay. So intrinsic muscles we can remember with the help of direction itself. So just you remember the direction, it will be done, sir. Superior longitudinal, inferior longitudinal, the transverse and the vertical muscle. And now what about the extrinsic muscles? Look at this diagram here right now. In this diagram, this will be the mandible here right now. And from the mandible, you can clearly see that there is a muscle beginning from here, and this muscle is going inside the tongue. This muscle is going inside the tongue here right now. And this muscle here will be genioglossus. This is genioglossus. Okay, genioglossus. And then there is a muscle coming from back here right now from the styloid process. This process here will be the styloid process, and from the styloid process this muscle coming inside here will be the styloglossus. And above you'll be having palate, and from the palate there's a muscle coming inside the tongue, and this is palatoglossus. And from below you'll be having hyoid bone. There's a muscle coming here right now, and that will be hyoglossus. So my dear friends, you'll be having muscles from, like, आगे, पीछे, ऊपर, नीचे. It's like anterior, posterior, above and below. So आगे you'll be having genioglossus, पीछे you'll be having styloglossus, above you'll be having palatoglossus, and then you'll be having hyoglossus from below. So please write down all these extrinsic muscles, guys. Number one, extrinsic muscles. Number one, you'll be having genioglossus. Number two, there will be styloglossus. And number three, there will be above. There is a muscle above that will be palatoglossus. And there will be muscle from below, and that muscle will be hyoglossus. Okay. So there will be genioglossus in the front, and the styloglossus behind, then the palatoglossus from above, and hyoglossus from below. Perfect. So this will be the, go ahead. Muscles of tongue we can divide into two categories: intrinsic and extrinsic. Inside the tongue and outside the tongue. Inside the tongue, intrinsic will be having superior longitudinal, inferior longitudinal, and then you'll be having transverse muscle and the vertical muscle. And outside extrinsic muscle will be genioglossus, styloglossus. From above there will be palatoglossus, from below hyoglossus. Now let us see the MCQs possible here. MCQ number one. Can anyone tell me which one is the largest muscle of the tongue? Largest muscle of tongue. Yes, right down there, guys. The largest muscle of tongue will be genioglossus. Number 1 point. Number 2 point. Remember, genioglossus itself is also known as the safety muscle of tongue. This question has largest muscle of the tongue, genioglossus. Safety muscle of the tongue, genioglossus. And remember, palatoglossus is not muscle of the tongue, sir. Palatoglossus will be not a true muscle of the tongue. Now, what is the meaning of this one? From the name itself, you can understand, guys. Palatoglossus. Palato, that muscle belongs to the palate also, palate muscles, and that muscle belongs to tongue also. Palatoglossus is not a true muscle of tongue. Not a true muscle of tongue. So I want you to remember like 3 MCQs here, but right now possible. Largest muscle of tongue will be genioglossus. Safety muscle of tongue will be genioglossus, and not a true muscle of tongue, it will be palatoglossus. Palatoglossus is not a true muscle of tongue. So these 3 MCQs you got to remember. Done. So okay. Now if you're done with the muscles of the tongue right now, guys, the next thing that you need to learn here is about the nerve supply of the tongue. Why safety muscle of tongue? The reason behind it is the safety muscle of tongue here is that from genioglossus muscle will enter into the tongue here right now, and it is helping in protrusion of tongue. It is helping in taking the tongue forward. So whenever you are trying to lie down on the pillow like this, the tongue will try to fall back. And if the tongue falls back, it is going to close the glottis. When the tongue falls back, it is going to close the glottis. Okay? So therefore, we need to prevent that. And to prevent that, tongue has to be a little bit forward, aage. And that is the reason why it is known as the safety muscle of tongue. Safety muscle of tongue is genioglossus. Largest genioglossus, safety muscle is genioglossus, and not a true muscle will be palatoglossus. Now, once you are done with the muscles of tongue, guys, now next one write down there as the nerve supply of tongue. Nerve supply of tongue is one of the very important topic here right now, guys. You can always expect one question from here. I can divide the nerve supply of tongue into 2 categories. Number 1, the motor supply, and number 2, the sensory supply. Nerve supply of tongue is divided into 2 categories. Number 1, it is motor, and number 2, it will be sensory. Now, what is the meaning of motor here right now, sir? Chalo, likho, write down this, sir. All muscles of tongue, all the muscles of tongue will be supplied by the 12th cranial nerve, that is hypoglossal nerve. But you have to remember what, guys? Exception. Everyone knows that all the muscles of tongue are supplied by hypoglossal nerve, but you got to remember the exception there. Except which muscle? Except palatoglossus. Except the palatoglossus muscle. All the muscles of tongue will be supplied by 12th nerve except the palatoglossus muscle. And remember, palatoglossus muscle will be supplied by vago accessory complex. In short, we'll write it as VAC. That means it will be supplied by the vagus nerve, the 10th cranial nerve, and accessory nerve, that is the 11th cranial nerve. Vago accessory. So all the muscles of tongue will be supplied by 12th nerve except the palatoglossus. Palatoglossus will be supplied by vago accessory complex, VAC. That completes the motor supply. Now once you are done with the muscles, now welcome to the sensory supply. Now this is a little bit dangerous one, sir. Okay, why I'm telling you a dangerous one here is sensory supply we can again divide into two categories. From the tongue we have got special sensation. What is the special sensation from the tongue? That is the taste. The special sensation from your tongue will be the taste. And apart from special sensation, we even have got the general sensation from the tongue. Now what is the meaning of general sensation from the tongue, guys? We will be having like temperature, touch, pressure. All this we can sense from the tongue. From tongue we can sense the temperature, the touch, pressure, everything. That comes under general category. Now my dear friends, I can give you one best example. For example, I'm drinking coffee. If I drink coffee, number one, taste of the coffee. Taste of the coffee comes under which category? Special sensation. Okay, and whereas the temperature of the coffee comes under general sensation. So that is one of the best examples. But what is the headache here? What is the problem here is that you need to remember which nerve will be carrying special sensation and which nerve will be carrying general sensation. For this you have to remember like two nerves. Which nerve for general sensation and which nerve is for special sensation. And to make it easy, do one thing. Draw the diagram like this, sir, as I'm drawing. For example, if this is your tongue here right now, divide the tongue into the anterior 2/3 and then there will be posterior 1/3 and then you'll be having the posterior most part. There'll be anterior 2/3, posterior 1/3 and the posterior most part. And once you divide the tongue like this, guys, write down there as 5, 7, 9 and 9 and then 10 and 10. 5, 7, 9, 9, 10, 10. Anterior 2/3 of the tongue 5 and 7, posterior 1/3 9 and 9 and the posterior most part of the tongue 10 and 10. Is it okay? For palatoglossus, both 10th and 11th are in the option, then what should be the answer? If both 10th and 11th are in the option, that is actually a wrong question, guys. It should not be like that. The correct answer is together they are going to form vago accessory complex. If still they are giving like that, you can mark 10th one, but that is wrong. Okay. Now look at the sensory supply. Remember 5, 7, 9, 9, 10, 10. So what is the meaning of this 5, 7, 9, 9, 10, 10? Now look here very carefully. From the anterior 2/3 of the tongue, remember the taste sensation, I mean to say special sensation that is taste will be carried by 7th cranial nerve, that is your facial nerve. I repeat again, anterior 2/3 of the tongue, taste will be carried by, special sensation will be carried by 7th cranial nerve. Which one? Facial nerve. Whereas the general sensation will be carried by 5th cranial nerve, that is your trigeminal nerve. Is it okay? So anterior 2/3 is like quite confusing, guys. So please spend some good time here and learn properly. From the anterior 2/3 of the tongue, special sensation, that is taste, is carried by 7th one, and general sensation will be carried by the 5th cranial nerve, that is the trigeminal nerve. Clear? Now once you are done with that one, there is no confusion at all. Posterior 1/3, both special general will be carried by 9th one. Posterior 1/3 of the tongue, both special as well as general sensation will be carried by 9th cranial nerve, glossopharyngeal, and posterior most part, both special and general will be carried by vagus. So here you don't have any confusion, no confusion at all. The confusion is all about the anterior two-third. Remember that carefully. And the best way to remember, in your textbook it is given like paragraph, paragraph. Don't learn like this. Best way, draw the diagram like this: 5, 7, 9, 9, 10, 10. Easy way to remember: 5, 7, 9, 9, 10, 10. Is it okay? And that is all about the sensory supply of the tongue. So I just repeat for the last time, guys. From the anterior two-third, taste will be carried by 7. Posterior one-third, taste will be carried by 9. And posterior most part, taste will be carried by vagus. Whereas anterior two-third, general sensation will be carried by fifth one, trigeminal nerve. And here though, no problem at all. Is it okay? And that completes one of the most important topic, tongue. And definitely take it guaranteed, you can write there. Definitely one question will come in the MCA exam from the tongue topic, either muscles or the nerve supply. Now once you are done with this topic, guys, now the next topic that we are going to learn yes, the next topic that we are going to learn here will be the dural venous sinus. Dural venous sinus. Guys, the very first topic that we have learned, neuroanatomy. If you remember neuroanatomy, okay, our brain will be covered by 3 meninges. For example, if this is your brain here right now, guys, our brain is actually covered by how many meninges? 3 meninges. There will be a innermost meninge, our brain is covered by like 3 meninges. There will be an innermost meninge, pia mater, then we'll be having the arachnoid mater, and then we'll be having the outermost meninge, and that will be the dura mater. And outside the dura mater, you'll be having what, guys? You'll be having the bone. Which bone do you have, sir? Cranium. Your cranium, okay? So that's the arrangement. Brain is covered by like 3 meninges, pia mater, arachnoid mater, and dura mater, and outside we'll be having cranium. Now today our topic is dura mater. You know, dura mater is intermade up of 2 layers. Dura mater is intermade up of 2 layers. Dura mater is intermade up of like 2 layers. Now today I'll teach you how to remember the names of these 2 layers. This outer layer of the dura mater is just inside the bone. The outer layer of the dura mater is just inside the bone. So that is why it is known as the endosteal layer. Endosteal layer. And this inner layer of the dura mater is towards the meninges, and that will be the meningeal layer. Okay? Wow, that is easy for us. So please update your knowledge. Till now you know that there will be 3 meninges, but remember dura mater has got like 2 layers. One is the endosteal layer, another one is the meningeal layer, guys. And easy to remember. The one which is outer side is inside the bone, endosteal layer, and one is towards the meninges, meningeal layers. Endosteal and the meningeal layer. Comfortable? Dura mater has got 2 layers. One is the endosteal layer and the meningeal layer. Endo means inside, inside the bone, endosteal layer, and this is towards the meninges, meningeal layer. Simple. Okay. And now let us see the arrangement of this one, guys. Guys, do you remember this diagram here right now? First day, neuroanatomy, cerebral hemispheres, and then this one here, imagine that this one is your cranium. Okay, so our brain is actually covered by what, right? The cranium bone. Brain is covered by what, right? Cranium bone. And now let me draw the 2 layers of dura mater. Let me draw the 2 layers of dura mater. Number 1, endosteal layer. Endosteal layer is just inside the bone, and it is traveling along with the bone, guys. Oh my god. endosteal layer is going to, it is actually just inside the bone like this, traveling along this. That is endosteal layer. Now imagine meningeal layer inside. So I request all of you to please study this or understand this at once, guys. Okay. So endosteal layer is just lining inside the bone, whereas meningeal layer is very closely attached to the endosteal layer here, very closely attached to that. But wherever there is a fissure, the meningeal layer will enter inside the fissure, and then it will take a turn, and then it will come outside and again join. फिर से दोबारा उसके साथ में मिल जाता है. And remember, these two are the layers of what, guys? Dura mater. So I repeat for the last and final time, endosteal layer is lining the bone, whereas meningeal layer will be going inside the fissure, then again coming out and going there. Meningeal layer will be going inside and then coming out. Now because of this type of arrangement, what is going to happen here right now? Because of this kind of arrangement, what is happening? You can clearly see that there is a space formed here right now, guys. Okay. And guys, whenever there will be a space, that space is known as, guys, sinus. And this space is actually going to collect the blood. And whatever blood is collected blood will be always venous blood, venous sinus. It's not arterial blood, it is venous blood. And you can clearly see this sinus, venous sinus, is between the two layers of dura mater. So because it is between the two layers of dura mater, it is known as the dural venous sinus. Wow, lovely. Look at the beautiful concept. So what is the meaning of the dural venous sinus? The space between the two layers of the dura mater. And the problem with the MBBS student, they don't even know dura mater has got two layers. Dural venous sinus. Meaningful name. Are you all done? Dural venous sinus. Are you all comfortable? Sure, done. So between the two layers of the dura mater, you will be having a space, and that is known as the dural venous sinus space. Guys, do you know how many dural venous sinus do you have? How many dural venous sinus do you have? There will be totally 23 dural venous sinuses. And out of the 23 dural venous sinuses, 8 will be the paired sinuses, and there will be 7 unpaired sinuses. Okay, so dural venous sinuses will be totally 23 dural venous sinuses. 8 will be paired and 7 will be unpaired. 8 paired means how many will be there, guys? 16. And 7 unpaired will be how many there, guys? There will be totally 7 only. So 16 plus 7 will be totally 23 dural venous sinuses. How many? 23. And if you want to see all the 23 dural venous sinuses, this is how it looks like. How many? 23 dural venous sinuses. It looks like this. But thank God you don't have to learn all of them for your MC exam. That you have to learn for the PG exam. And right now we are going to learn only and only one, that is cavernous sinus. Cavernous sinus. Okay. We need to learn only one, that is cavernous sinus. So please write down the heading as cavernous sinus. Cavernous sinus. Now the only one that we have to learn is the cavernous sinus, guys. Okay. Now in the in a cavernous sinus here, first of all, try to learn that, yes, is it like paired sinus or unpaired sinus, guys? It will be paired sinus. Okay, guys, please, everyone, please concentrate here right now. These are like very much important topic, guys. What is the things going on? Cavernous sinus will be a paired sinus. And now if it is a paired sinus, where it is present, it is on either side of body of sphenoid bone. ठीक है? Cavernous sinus is actually a paired sinus, and this paired sinus is on either side of the body of the sphenoid bone. Cavernous sinus is actually paired, and paired कहाँ पर होता है? On either side of the body of the sphenoid bone. If you remember our yesterday's diagram, sphenoid bone, I have shown you that pink colored one in the middle, body, lesser wing, greater wing and all. So on either side of the body, you'll be having the cavernous sinus. Okay. And now let us draw the diagram of the cavernous sinus in coronal section. So I'm going to cut from here like this, coronal section, remove everything from the front and then see from the front, guys. Let us see the coronal section right now. Now in the coronal section, my dear friends, this one will be the sphenoid bone. And this is actually the body of sphenoid bone. Okay, this is the body of the sphenoid bone, guys. Guys, why am I drawing this body of the sphenoid bone like this? Have you heard about the paranasal air sinuses? Para means surrounding, and surrounding the nose. Paranasal means surrounding the nose. These bones are not like solid bones, they're not like dense bones, they're actually having air spaces inside, air sinuses inside. Okay? That is the reason why our head is very much lighter. Our head is lighter because of the presence of the paranasal air sinuses. Okay? You'll be having maxillary air sinus, frontal air sinus, ethmoidal, sphenoidal inside. So this is sphenoid bone, and sphenoid bone will also have air sinus inside. You can see this bone is filled with air. That is the reason why our head and neck, this will be like, very much lighter. So this is like paranasal air sinuses. Paranasal air sinuses. And now in this paranasal air sinuses, yes, remember, apart from this sphenoid bone, imagine this one to be your cranium here right now, guys. So I'm cutting like this, cranium. And here in the middle you are having brain. I'm not going to draw the brain, it will be becoming more complicated. Dura mater, how many layers? 2 layers. Endosteal, meningeal. Imagine the outer one to be endosteal layer. Endosteal layer is coming from here, and it's going like this. Imagine this one on the inner side to be the meningeal layer. Meningeal layer on the inner side here, going like this. Okay? So there will be endosteal layer, there will be meningeal layer. And between these two layers, can you just see the arrangement here? Between the endosteal layer and the meningeal layer, here there is some additional space here right now, guys. And this space will be the sinus, and that sinus is known as the cavernous sinus. Wow, beautiful. And you can imagine the same cavernous sinus on the other side also. So that is the reason why I made you write down cavernous sinus is a paired or unpaired? Paired. On this side also, this side also. And it is on either side of the body of the sphenoid bone. Are you all comfortable till here? Perfect. Now what points you have to remember here is that point number 1, there is a cranial nerve number 3 here, there is a cranial nerve number 4 here, there is a cranial nerve number 5-1 here and 5-2 here. Cranial nerve number 3, 4, 5-1 and 5-2. And these cranial nerves are actually passing from which wall? They are actually passing from the lateral wall. This is lateral wall, this is medial wall, this is the roof, and this will be the floor. Okay? Lateral wall, medial wall, the roof and the floor, guys. So therefore, my dear friends, write down there, passing through lateral wall of cavernous sinus. Cranial nerve number 3, cranial nerve number 4, cranial nerve number 5-1, and cranial nerve number 5-2. Passing through the lateral wall, you'll be having cranial nerve number 3, 4, 5-1, 5-2. 3, 4, 5-1, 5-2. 3, 4, 5-1, 5-2. And what is going to pass inside the cavernous sinus? You will be having internal carotid artery, and then there will be one more cranial nerve here, and that will be the cranial nerve number 6. Write down. Passing inside the cavernous sinus will be the internal carotid artery and the cranial nerve number 6. So what is the nerve that is going? What are the nerves that are going to pass through lateral wall? That is 3, 4, 5-1, and 5-2. And what is passing inside the cavernous sinus will be having internal carotid artery and cranial nerve number 6. So guys, it is in like very sequential order. Lateral wall will be having like 3, 4, 5, and inside will be having 6th one. Perfectly done, sir. I hope you all are done with this one here. So finally, these are the only two important topics that you have to remember. So these are the two important points that you have to remember, guys. Okay. So this is like one of the most difficult topic in anatomy, and it is made extremely easy, crystal clear. And if you want to see the same diagram here in the textbook, look at this diagram here in the textbook, guys. Hello, my dear friends. This one here will be the sphenoid bone. Sphenoid bone, and this sphenoid bone on either side will be having cavernous sinus and cavernous sinus, and this cavernous sinus on the lateral wall. Come on, identify lateral wall. 3, 4, 5-1, 5-2. 3, 4, 5-1, 5-2. And what is passing from inside? Inside will be having internal carotid artery, and this is the 6th cranial nerve, 6th one. Topic done. I'm done with the topic right now, guys, and that completes your dural venous sinuses and cavernous sinus. चलो, अब हम बढ़ते हैं आगे. Now we are going to move ahead. Guys, do you know about larynx, pharynx, and palate? That is another very difficult topic, you know, in this head and neck topic here. And many times questions are being asked about the nerve supply. All the muscles of larynx will be supplied by larynx. All the muscles of larynx are supplied by which nerve? Can you answer me? All the muscles of larynx are supplied by? Except which muscle? Except which muscle? Oh my god. So chalo, suno. That is what I am going to teach you right now, guys. All the muscles of larynx, all the muscles of pharynx, and all the muscles of palate. You have to remember the nerve supply. You have to remember the nerve supply. And not only the nerve supply, you need to even remember the exceptions. That is dangerous one. So now another 15-20 minutes, I'm going to make it easy for you people. Listen here right now. We are now going to learn about the larynx, pharynx, and palate. So just concentrate here. To learn that, we need to draw the diagram of the vagus nerve. Vagus nerve. That is your 10th cranial nerve. Vagus nerve, that is the 10th cranial nerve. Fine. Now I request all of you to do one thing here right now, guys. If you are drawing the diagrams with me, okay, take a fresh page, and on one page you have to draw the entire diagram of the vagus nerve. It will be a big diagram, so that is why it will not come on half of the page. Take a fresh page, complete diagram. Now try to recall from our first topic, neuroanatomy. In neuroanatomy, we have studied that vagus nerve is going to begin from medulla oblongata. This is medulla oblongata, imagine, and below here this is spinal cord. Guys, this is one topic where we cannot repeat it again and again. So try to be completely with me. Don't get distracted here and there, and try to understand it completely with me right now, guys. Medulla oblongata, it will be having the nucleus, and from this nucleus, the cranial nerve number 10 will begin from here. Imagine this is your 10th cranial nerve, guys. Now, whatever I taught you till date, each and everything you have to apply here, sir. Each and everything, like all the knowledge. Yesterday only I taught you in the evening, I think the last topic that we have studied. 10th cranial nerve is passing through a foramen, and what is the name of the foramen, guys? Jugular foramen. You remember jugular foramen? Cranial nerve number 9, 10, 11. Cranial nerve number 9, 10, 11 is passing through jugular foramen, and this is the 10th one. Now, I hope all of you remember that there will be a common carotid artery, and that will divide into internal carotid, external carotid artery. Common carotid artery, and that will be bifurcating or dividing into internal carotid artery and external carotid artery. And right at the place of bifurcation, my dear friends, जहाँ पर वो bifurcate होता है, I hope you have studied in physiology. There will be carotid body, and there will be one more thing that is known as carotid sinus. So where do you have this carotid body and carotid sinus? The carotid body and carotid sinus, remember, both of them are present right at the bifurcation of common carotid artery into internal and external. Bifurcation of the common carotid artery into internal carotid artery and external carotid artery. At that place you'll be having carotid body and carotid sinus. Is it okay? And what do you have in this carotid body and sinus? Please study that in physiology. It will consist of baroreceptors and chemoreceptors. Baro and chemo. And from there what will happen? The information, baro means pressure, that information will be carried by the 10th cranial nerve. Understanding here right now? So this is the first thing to learn. Is it done? Are you all done? Perfect. So from the medulla oblongata, I repeat once more, last and final time, guys. From the medulla oblongata, there will be a nucleus, and from there begins your 10th cranial nerve. And that 10th nerve is going and supplying to carotid body and carotid sinus. Where do you have that carotid body and sinus? At the bifurcation of common carotid artery into internal, external. Okay, done. And now first I am going to teach you about the larynx. Okay. So what diagram are we going to draw right now? Everyone please look at this diagram now. Yes, sir. Everyone please look at this diagram here right now, sir. Now in this diagram, first of all, you are able to find your hyoid bone. In this diagram, this will be the hyoid bone. Hyoid bone here. Below the hyoid bone, there will be cartilages of larynx. Larynx, you will be having 9 cartilages. I hope you have studied in ENT. The larynx will be having like 9 cartilages. Out of that, this biggest one here will be the thyroid cartilage. Thyroid cartilage. Adam's apple. Thyroid cartilage. And below that, you will be having the cricoid cartilage. The round one, that is cricoid cartilage. Okay. So we are going to draw this diagram here right now, guys. Hyoid bone, thyroid cartilage and cricoid cartilage. चलिए ये वाला diagram हम draw करते हैं. Now my dear friends, in this diagram on this page, leave some space above here right now. Okay, start drawing the diagram below here right now. Please draw the diagram below here. There will be greater horn, lesser horn, body of the hyoid bone, and again greater horn, lesser horn. hyoid bone. Greater horn, lesser horn, body in the middle, lesser horn, greater horn. Now just below the hyoid bone, you'll be having the thyroid cartilage. Or let me draw it like more properly. This is thyroid cartilage. And below the thyroid cartilage, again we'll be having one more cartilage here right now, and this one will be the cricoid cartilage. Hyoid bone, thyroid cartilage, and cricoid cartilage. Now try to remember one very important point here right now, guys. A golden rule, the golden point here right now. All the muscles of larynx are inside the larynx. All the muscles of larynx are inside the larynx, except for one muscle of the larynx that is outside. And the only one muscle of the larynx which is outside the larynx will be between cricoid cartilage and thyroid cartilage. That is why cricothyroid muscle. The only one muscle of the larynx that is present outside. Remaining all the muscles of larynx are inside the larynx. Only one muscle of larynx is outside. It is cricothyroid muscle. And then after that, there is one membrane between the thyroid cartilage and hyoid bone. And this membrane between the thyroid cartilage and hyoid bone, this membrane here will be the thyrohyoid membrane. Thyrohyoid membrane. That is between the thyroid cartilage and the hyoid bone, thyrohyoid membrane. Okay? So this is how the arrangement will be there, sir. Chalo, I am done with the arrangement here right now. I repeat once more here right now, guys. This is hyoid bone, thyroid cartilage, and cricoid cartilage. The only one muscle of the larynx outside, cricothyroid muscle, and there is a membrane here, thyrohyoid membrane. And now, my dear friends, vagus nerve, the 10th cranial nerve, vagus nerve will give a branch, and that branch will be your superior laryngeal nerve. Superior laryngeal nerve. And that superior laryngeal nerve will give actually divide into two branches. Look at the meaningful name here, so beautiful. It will be divided, will be going and supplying to the muscle outside. It is going and supplying to the muscle outside, externally. External laryngeal nerve. Wow. So this muscle is going in, this nerve is going and supplying to the only muscle outside. That is why outside, external. Meaningful name. Learn up to the research level. Why doctors kept the name like that. And then one more nerve, it is going to pierce this membrane and go inside. And that nerve will be internal laryngeal nerve. Oh, beautiful. I repeat again. Vagus nerve will be giving to a branch, superior laryngeal nerve, that will come and divide into two branches. The name is so meaningful. The one which is supplying to the outside muscle, external laryngeal nerve, and one which is going inside, internal laryngeal nerve. Now, my dear friends, what about this internal laryngeal nerve right now? It will be going inside and supplying to mucosa of larynx. And that too only above vocal cords. That means it is not supplying to any muscles and all. It is not a motor nerve. It is actually sensory nerve. It will be supplying to what this mucosa. So it is supplying to mucosa of the larynx above vocal cord. Internal laryngeal nerve will be supplying to mucosa of the larynx above the vocal cord. Done. That is about the superior laryngeal nerve. हो गया sir. Now the vagus nerve, 10th cranial nerve, will give one more branch, and that one more branch will actually go down and again come back to the larynx, guys. Look at the approach. It is going down and coming back, and that one will be the recurrent laryngeal nerve. What is that? Recurrent laryngeal nerve, guys. So vagus nerve will give one more branch that's going down and coming back. So therefore it is recurrent laryngeal nerve. Now, what is this recurrent laryngeal nerve supplying to? Recurrent laryngeal nerve will be supplying to everything that is left out. What is left out? Come on, number one, all muscles of larynx, except which muscle? Except cricothyroid muscle. Number two, recurrent laryngeal nerve will be supplying to what? Number two, it will be supplying to mucosa of larynx below vocal cord. And number three, this we did not learn till now. It will be supplying to one muscle of pharynx, and that will be the cricopharyngeus muscle. Oh my god. So this is all taken care by recurrent laryngeal nerve. So recurrent laryngeal nerve will be supplying to all muscles of larynx except cricothyroid. It will be supplying to mucosa of the larynx below vocal cord, and then one muscle of the pharynx, and that one muscle of the pharynx will be cricopharyngeus muscle, and that completes your larynx. Larynx completed, guys. Just confirm me if it is done. Sure. Now, if this is like crystal clear larynx, come on, sir. I asked you the same question. Answer now the same question, guys. Just 5 minutes before only I asked you. All muscles of larynx are supplied by? All muscles of larynx are supplied by recurrent laryngeal nerve. Very good. Recurrent laryngeal nerve. Except which muscle? Cricothyroid. That will be supplied by which one? Cricothyroid is supplied by which one? External laryngeal nerve. And that is a branch of superior laryngeal. Class. Crystal clear, guys. Okay. So I asked you the same question 5 minutes before. Look at the way how it is cleared right now, without any doubt. Okay, done. Now once this is done here right now, guys, now larynx completed. Now let us go towards the pharynx and palate. Larynx done. Now let us go towards the pharynx and palate. There is a cranial nerve number 11. Can anyone tell me what is the name of the cranial nerve number 11? What is the name of the cranial nerve number 11? Accessory. Yesterday I told you accessory nerve will be of two types. Accessory nerve will be of two types. Cranial accessory, spinal accessory. Cranial accessory, spinal accessory. Now my dear friends, remember the 11th cranial nerve, this one will be the cranial accessory part here right now, guys. 11th cranial nerve, that will be cranial accessory. Listen carefully right now. The cranial accessory nerve is going along with the vagus, and after going along with the vagus, it is going along with the superior laryngeal, and then from here it will be separating apart. Tenth nerve and the 11th nerve, they are going together from which foramen? Jugular foramen. Okay, and these two are going together. Therefore, these two together are going to form 10th nerve, vago, 11th nerve, accessory, vago accessory complex. Vago accessory complex, VAC. And if you are interested, this itself is known as pharyngeal plexus. इसी को हम pharyngeal plexus कहते हैं. Lovely. So 10th cranial nerve and the 11th cranial nerve together, sir. The 10th and the 11th cranial nerve together, they are going to form the vago accessory complex, and these two together, they are going to, form the pharyngeal plexus or vago accessory complex. And now let's go to the conclusion right now, guys. Vago accessory complex is taking care of all the muscles of pharynx. All the muscles of pharynx, sir. Vago accessory complex will be supplying to all the muscles of pharynx. All the muscles of pharynx, except two muscles. One muscle you already know, it's already there on the screen. Except cricopharyngeus. Wow. Cricopharyngeus muscle will be supplied by recurrent laryngeal nerve. It's already here below. Cricopharyngeus supplied by recurrent laryngeal nerve. And one more exception here will be the stylopharyngeus. And remember, stylopharyngeus muscle will be supplied by ninth cranial nerve, and ninth nerve will be glossopharyngeal. Okay? So exceptions are important, guys. So from today onwards, if anyone asks you, all the muscles of pharynx will be supplied by vago accessory complex, except for two muscles. Cricopharyngeus supplied by recurrent laryngeal nerve, and stylopharyngeus supplied by glossopharyngeal. There is one best mnemonic to remember this one. Stylopharyngeus, style, and for style we require glossopharyngeal. Stylopharyngeus muscle, glossopharyngeal. Stylopharyngeus, glossopharyngeal. Now once you are done with the pharynx here right now, guys, welcome to the last and final thing here right now, palate. Remember, even all the muscles of palate are also supplied by vago accessory complex. All the muscles of palate are also supplied by vago accessory complex. Except which muscle? Tensor veli palatini. Tensor veli palatini muscle, and that will be supplied by 5-3. What is 5-3? Very good. Mandibular nerve. That's all. And that completes your larynx, pharynx, and palate. Larynx, pharynx, and palate. Done. चलो सर, यहाँ पर देखिए everyone here right now, guys. I'll just repeat each and everything once and forever. I'll repeat all these things for once and forever. Now everyone look here. Yes sir. First of all, larynx. All the muscles of larynx are supplied by recurrent laryngeal nerve, except which muscle? Cricothyroid. Cricothyroid is the only muscle outside, and that muscle will be supplied by external laryngeal nerve. Done. All the muscles of pharynx are supplied by vago accessory complex, except two muscles: cricopharyngeus, stylopharyngeus. Cricopharyngeus, we wrote it here only. It will be supplied by recurrent laryngeal nerve. Whereas stylopharyngeus, remember, it is supplied by ninth cranial nerve, that is glossopharyngeal nerve. All the muscles of palate are supplied by, again, vago accessory complex, except one muscle of the palate, that is tensor veli palatini. Tensor veli palatini, that is supplied by mandibular nerves. That is supplied by mandibular nerve, and that completes larynx, pharynx, and palate. I hope it is done right now. Now let us go to the next topic right now, guys. Guys, can you again tell me what is the name of the 11th cranial nerve? What is the name of 11th cranial nerve? 11th cranial nerve? Accessory. Accessory will be having two parts: cranial and spinal accessory. Cranial accessory and spinal accessory. है ना? Now in this diagram you can clearly see cranial accessory हो गया. We are done with the cranial accessory वाला part. है ना? And now we are going to learn about the spinal accessory. So please write on the heading next topic, accessory nerve. Accessory nerve, that is 11th cranial nerve. Accessory nerve, that is 11th cranial nerve. Now here, this one will be the medulla oblongata and this spinal cord. Medulla oblongata and this one is the spinal cord here right now. So please write on there, this one is medulla, spinal cord. In the spinal cord, in the very beginning, you will be having like C1, C2, C3, C4 and C5. C1, C2, C3, C4 and C5. C1 to C5. From the spinal cord, C1 to C5. Now here what is going to happen, right from C1 to C5 there will be a nerve beginning from here. Look at the course. It will first enter inside the cranium and then it will take a turn, then come outside. Full time pass. So this nerve is first of all going to enter inside the cranium via foramen. Which foramen? Foramen magnum. That is something important to remember. It enters inside foramen magnum and then it is going to come outside. Again the same foramen. Which foramen? Jugular foramen. 9th and 11th. Oh my god. So spinal accessory will first enter inside here and then again it will be coming outside. This is 11th cranial nerve. Which component? Spinal. Cranial last diagram. Cranial accessory last diagram. Now this is spinal accessory. And now after coming outside there is nothing problem. The only problem is with these two foramen, foramen magnum and jugular foramen. Remember that. After coming out it is supplying to two muscles, sternocleidomastoid muscle, and then the big muscle behind, that will be your trapezius muscle. The moment you turn to a side here right now, guys, one muscle will be elevated here, that is sternocleidomastoid muscle here, and trapezius muscle. These two muscles will be supplied by 11th cranial nerve accessory, that to spinal accessory. Done. So that completes about the 10th cranial nerve and 11th cranial nerve. And 10th and 11th is done. Let us do with the 12th cranial nerve right now, guys. Okay. So let's go towards the 12th cranial nerve. Now, what is the name of the 12th cranial nerve? It will be hypoglossal nerve. And hypoglossal nerve will be the 12th cranial nerve. Again the same story. It is also going to begin from where only? From the medulla oblongata. So if this is the medulla oblongata, hypoglossal nerve is going to begin from the hypoglossal nucleus. And this 12th cranial nerve, after beginning from here, it is just going to go from here. The 12th cranial nerve is going to begin from medulla and it is going to go from here and supply to your tongue muscles. And just now we have seen it is going to supply to all the muscles of tongue. All muscles of tongue. Except which muscle? except palatoglossus. And palatoglossus muscle is supplied by VAC. Alas. Done. Okay, sir. That's all. It is very simple. So 10th nerve that we learned first, that is very much complicated. After that, 11th is a little bit okay, and 12th is easy. So 12th cranial nerve will go to the tongue and will be supplied to all the muscles of tongue except palatoglossus. Are you all done? Perfect. And now if you feel that this is like very easy, let us make it a little bit complicated right now, guys. Welcome here right now. C1, C2 and C3. Now guys, from C1, there is one nerve that is going to begin from C1 and that is going to go along with the 12th one. And after going along with the 12th one, that will go and supply to two muscles. One will be geniohyoid muscle. Another one will be thyrohyoid muscle. From C1, one more nerve will come along with the 12th one and will be supplying to two muscles, geniohyoid and thyrohyoid. Now in recent one of the MCA exam, the question was these two muscles are supplied by what? What is the nerve supply? Can you please answer me? What is the nerve supply to geniohyoid and thyrohyoid? Come on. Is supplied by C1, but don't say only C1, that will be supplied by C1 but via the 12th nerve. Okay, so the geniohyoid and the thyroid, these two are supplied by C1 but via the 12th one. Perfect. Okay, don't say only C1, it is C1 via the 12th one. Now once you are done with the with this one, guys, let's include one more topic here itself. Let us discuss. In my notes, what I'm trying to do is many topics we are trying to discuss at one place only. Even though we have discussed only the 10th cranial nerve, in that we are done with the larynx, pharynx, palate. So in that way, like many topics I'm trying to concise in one place so that our notes become easy to revise. So one more topic that we are going to learn here itself is from C1 I'll be getting one descending branch that is going to come down. Okay. From C2 and C3, these two will combine and descend down. Okay. And these two descending branches will combine together and they're going to form a loop. C1, from C1 coming down. C2 and C3 will combine together to form one more descending branch, and they will combine to form a loop here right now in the neck. And anything like a loop like structure in our body in anatomy, that is known as ansa, and that is in the neck region, cervicalis. Ansa cervicalis. Beautiful. So learn with meaning. Loop means ansa, and in the neck region it will be cervicalis. Ansa cervicalis. Loop like structure. Ansa cervicalis. Ansa cervicalis. Okay. So from C1 we'll be having one descending branch, and from C2 and C3 will be having one more descending branch, and this will combine together to form ansa cervicalis. And this ansa cervicalis will give three branches, and that is important for your MC exam. That ansa cervicalis here will be supplying to three muscles. Number one, sternothyroid muscle, sternocleidomastoid muscle, and omohyoid muscle. Sternothyroid, sternohyoid, omohyoid. Done? Are you all done? And by this we complete the topic of ansa cervicalis also here itself. Okay guys, is it okay? Now once this entire thing is done, 10th cranial nerve, 11th cranial nerve, 12th cranial nerve and ansa cervicalis, I'll give you like 2-3 minutes of time here guys. Please revise these 3 topics together at once. Come on, there's a lot of stuff done, please revise that. Are you all done with the revision? Chaliye sir. And now once you're done with the revision right now guys, let's concise everything at one place right now. Muscle innervation. Final conclusion right now. Okay, let's concise everything at one place. Number 1, all muscles of larynx will be supplied by recurrent laryngeal nerve except the only one muscle outside, cricothyroid muscle, and that will be supplied by external laryngeal nerve. Number 2, all muscles of pharynx are supplied by vago accessory complex except 2 muscles, brachopharyngeus muscle and stylopharyngeus muscle. Will be supplied by vago accessory complex, except tensor veli palatini, and that is supplied by mandibular nerve. All muscles of tongue, hypoglossal 12 cranial nerve, except palatoglossus, that will be supplied by vago accessory complex. Yesterday we have learned all muscles of mastication, that will be supplied by 5-3 mandibular nerves, and there is no exception there. Understanding here right now? And some people try to just mug up this and go to the exam. No way that you can just mug up and remember this for long term. The best way to learn this, my diagrams. So practice the diagram twice or thrice, and then you'll be becoming perfect in the muscle innervation, guys. Are you all done? Chalo guys. Now this was all the difficult topics in the head and neck, sir. In head and neck, we are done with the cranial foramens yesterday, and the muscles of mastication, and then today we are done with the tongue, and after tongue we are done with dural venous sinuses, then the vagus nerve, accessory nerve, hypoglossal nerve, larynx, pharynx, palate, all difficult topics there. Let us just now do a little bit easier topic, guys. So please write on the heading there as facial artery. Now let us learn about the facial artery, guys. I'm now going to teach you like 3 easy topics, guys. We'll learn about the artery to the face, vein of the face, and nerve supply of the face. We'll learn 3 things. 3 easy topics we'll learn, and then we'll take a small break, okay? So artery, vein, and then the nerve to the face, okay? So we'll learn 3 easy topics. First of all, facial artery. Remember, facial artery, it is a branch of external carotid artery. Common carotid artery will divide into internal, external. External carotid artery, remember, external carotid artery will give totally 8 branches. Don't worry about that, I'll teach you today. External carotid artery will give like 8 branches. Out of that 8 branches, one of the branch will be facial artery. Facial artery will be one of the branch. Clear? And now the next thing that we need to learn is what about the course and what about the branches of facial arteries. The course and the branches of facial artery. Okay? And now do one thing, guys, stop writing and first look at this diagram here right now. Now in this diagram here you can see this one is external carotid artery. External carotid artery will give a facial artery. Facial artery is first in the submandibular region below the mandible, and then it is taking a turn, and after taking a turn the facial artery is moving up obliquely in the face, obliquely, okay? So it's moving obliquely in the face and finally going and ending here near the medial angle. I repeat again. In this diagram here, this will be the external. This will be the external carotid artery, and that will give the facial artery first in the submandibular region below the mandible. Then it is going to take a turn, and then after that it is moving up. Obliquely it is moving up, and finally ending near the medial angle of the eye. Here it is ending here. So that is about the entire course of the facial artery, the way it is traveling. Okay, so let's draw the diagram. Now the course and branches. Now here you'll be having your external carotid artery, imagine. And this will give a facial artery branch, and that is going in the submandibular region, then taking a turn. And then it will be going like, moving upwards. And beautiful. Done. Now once you are done with the course here right now, guys, now let us see what are the branches given by the facial artery. Facial artery will give in the face, it will be giving like 4 branches. First of all, it will give a branch to the lower lip, inferior labial artery. It will give a branch to the upper lip, superior labial artery. Inferior labial artery, and then the superior labial artery. And it will be giving few branches to the lateral wall of the nose, lateral nasal branches. And finally near the medial angle, it will be angular branch. So in the face here right now, guys, the facial artery will be giving 4 branches: angular branch near the medial angle of the eye, lateral nasal branches, superior labial, inferior labial. If you want to see all these branches here in this diagram also, you can see here. One of the branch will be to the lower lip, inferior labial, to the upper lip, superior labial, lateral wall of the nose, lateral nasal, and then angular. Then the facial artery will also give like 4 branches in neck. Okay, now somewhere here in the neck, it will be giving like 4 branches. And that you can remember as STAG, stack. Submental artery, T for tonsillar artery, A for ascending palatine artery, and G stands for glandular artery. See, in the mandible, I think if you have learned this one, at least you have learned this one, I think in your MBBS days. In your mandible, this part is known as mental part, and below the mental part of the mandible, submental artery. Submental. Well, it is taking a turn here, submental. Then tonsillar, then ascending palatine, and then glandular artery. Gland. You'll be having your salivary glands here right now. Glandular artery. So facial artery is actually basically giving 4 branches in the neck region and 4 branches in the face. 4 in the neck and 4 in the face. Please confirm me if you're done, then we'll move ahead. Okay, and now please add a note there below, sir. Write down there, number 1, facial artery is tortuous artery. Facial artery is tortuous. Guys, what is the meaning of tortuous? Just look at the course here right now. If you look at the facial artery is very much, tortuous. It's like not going straight like other arteries. If you see other arteries, they're just going simply straight like this. But facial artery is taking a turn like this. It is very much tortuous. It is very much tortuous. So in our body, there are few arteries which are tortuous. So you need to remember the examples. Okay. So one of the examples is facial artery. It is tortuous. The reason is very simple. The facial artery is very much close to your mouth. If the artery is very much straight, अगर मान लो कि artery straight होता, then the moment you open your mouth wide, the artery would have been ruptured. That is why God kept the artery already tortuous. You are allowed to open your mouth as much as you want. Okay, so the facial artery will be tortuous. One important MCQ. Number two, second important MCQ. Can you just see where is this facial artery turning? Facial artery कहाँ पर turn हो रहा है? Can you please tell me what is this muscle here right now, guys? Look at the screen. What is this muscle? What is that muscle? No. Sternocleidomastoid will be here. Yeah, very good. Yesterday I told you this one is the masseter muscle. Yesterday I even shown you this is masseter muscle. And this masseter muscle, this is the anterior border. Anterior border of the masseter, antero-inferior to be more specific. Antero-inferior. Repeat again, antero-inferior border of masseter. Here facial artery is taking place, taking a turn there. You have to remember that landmark very carefully. Where is the facial artery taking a turn, sir? Antero-inferior border of masseter. Facial artery turns at antero-inferior border of masseter. Perfect. So that completes each and every point that is required about the facial artery for your MC exam, guys. So facial artery is a branch of external carotid artery, 4 branches in face, 4 branches in the neck, and these points, if you remember, more than enough about the facial artery, sir. Sure. Should I remove this? Perfect. Now once you are done with the artery, as I promised you, we are going to now learn about the veins, guys. So please write on the heading as veins of face. Now veins of the face, my dear friends, there is one vein coming from the temporal region here, and that is going to join with the maxillary vein. Now what will be the name of this vein which is coming from temporal region here? Temporal region here right now, guys. That vein will be the superficial temporal vein. Superficial temporal vein. And this superficial temporal vein is going to combine this vein. This vein is coming from maxillary vein. Superficial temporal vein combines with the maxillary vein. Superficial temporal vein combines with the maxillary vein. And now these two veins will combine together. Please look at me here right now. These two veins will combine together to form a vein. That vein will be behind mandible. Mandible ke piche. Retromandibular vein. So this vein here will be the RMV. I'll write down the full form here. RMV. Retro behind mandibular vein. Is it okay? So superficial temporal vein combines with the maxillary vein, and both of them will combine together to form retromandibular vein, sir. Retromandibular vein. And now this retromandibular vein is divided into two divisions here right now. One will be the anterior division, another one is the posterior division. I'm just writing in short, anterior division and the posterior division. Anterior division will be combining with the vein coming from your face. Come on guys. What is the name of this vein which is coming from the face? Facial vein. And these two together they're going to form your common facial vein. And this common facial vein, my dear friends, will go and get drained into internal jugular vein. Is it okay? तो चलिए सर एक बार फिर से रिवाइज करते हैं. Let us revise it once more. See, the best way to learn this will be, applying on your face, guys, so that you can correlate. You can correlate this temporal, maxillary, and all. Okay, try to understand the meaning and learn. This is coming from the temporal region, superficial temporal vein. Superficial temporal vein combines with the maxillary vein. These two together we are going to form retromandibular vein behind the mandible. Divide into anterior division, posterior division. Anterior division combines with facial vein to form common facial vein, and that is going and draining into internal jugular vein. So, next one, there is a vein which is coming from behind the auricle, and what is the name of this vein, guys? That is posterior auricular vein. The posterior auricular vein is going to combine with the vein, that is the posterior division, and these two will combine together to form your external jugular vein. Oh my god. So the posterior division will combine along with the posterior auricular vein. These two will combine together to form external jugular vein, sir. And that completes all the veins of the face. There is a complete W shape formed here. W. Now please look at this diagram here right now. This diagram is from your, Gray's Anatomy. Sorry, Chaurasia, BD Chaurasia, your favorite one. In this diagram, you are able to see all the veins of the face. Now let us correlate. What is this one? This is superficial temporal vein combines with maxillary vein. These two will combine together to form retromandibular vein, and that will divide into anterior division, posterior division. Anterior division will combine with the facial vein to form common facial vein, and that will go and drain into internal jugular vein. Posterior division will be combining with posterior auricular vein. These two will combine together to form external jugular veins. That's all. That's about the veins of the face. And now welcome to the last and final thing. Artery done, veins done. Now let us learn about the nerve supply of the face, guys. Okay? So please write down the heading as nerve supply of the face. First, let us learn about the motor. Motor means muscles. All muscles of face, or we can say facial expression. All muscles of facial expression are supplied by seventh cranial nerve, seventh nerve. All the muscles of face are supplied by facial nerve. Don't even remember that. They will never ask you in the exam. Everyone knows that. It is very common. Don't even remember that. They will never ask you. What they will ask in the exam is except which muscle. Except one muscle, and that muscle will be LPS. Levator palpebrae superioris. You know this LPS muscle? Levator means elevating. Palpebrae means eyelid. Superioris upper eyelid. So elevating upper eyelid. Levator palpebrae superioris. And this will be supplied by your third nerve, oculomotor nerve. The third cranial nerve. That's something important that has been already asked in the MCA exam. Guys, wherever exception, there will be a question. So exceptions are important here, right? So please remember that. All the muscles of face are supplied by facial nerve. Everyone knows that. What you have to remember is exception. Except which muscle? Levator palpebrae superioris. That will be supplied by oculomotor nerve. Third nerve. Now welcome to the sensory supply. What about the sensory supply to the face? Come on. We are able to sense almost everything from the face, guys. We are able to sense the touch, temperature, pressure, everything from face. And remember, the sensory supply, everything from the face will be by trigeminal nerve. Trigeminal nerve, the cranial nerve number 5. So it's a very important one, guys. Trigeminal nerve will be the nerve which is going to carry all the sensory impulses from the face. Okay, so you're able to sense the touch, you're able to sense the temperature, pressure, everything. Yeah. Suppose if you don't study and clear the MCA exam, sometimes daddy will touch you, and when daddy will touch you, like it will be like with all the sensations. Okay, daddy will touch you, it will be like full pressure with temperature, and the pain तो भरपूर होता है उसमें, automatically temperature बढ़ जाता है, ठीक है? So you're able to sense everything from the face, and how you are able to sense that? That's because of. Thank God to the trigeminal nerve. Is it okay? Now that is not that much important, guys. The important thing is exception. Except the skin over angle of mandible. And this has been asked like 2 or 3 times in your MCA exam. The skin over the angle of mandible. You know angle of mandible? Mandible is taking a turn here. This much skin. And that skin will be actually supplied by great auricular nerve. Great auricular nerves. Is it okay? Always remember exceptions. Okay, I'm done with the motor supply. I'm done with the sensory supply. Entire sensory supply from the face by trigeminal, except for the skin covering angle of the mandible. Skin covering angle of the mandible by great auricular nerve. Great auricular nerves. That's all, guys. I'm done with the artery, I'm done with the vein, I'm done with the nerve supply to the face. Done. In one of the exams, they have even given the image-based question, sir. The image was something like this. And in this image, yes, the skin covering the angle of the mandible is supplied by great auricular nerve. The skin covering the angle of the mandible is supplied by great auricular nerve here. Okay? So that is all about these topics here. So all the difficult topics are done. Now let us take a small break here right now. After the break, we are going to learn about the neck region, guys. Is it okay? So let's take a break here for another 15 to 20 minutes. Then I'll join you back. Before that, what is the score? Let's start the class right now, guys. Just confirm me whether I'm visible and audible. Yes. Now the next thing that we're going to learn. So once we're done with the the head wala part, now we are going to learn about the neck wala part. And in the neck, the first thing that we are going to learn is about the transverse section of the neck. transverse section of neck. So first of all, let me show you this section here right now, guys. Let me take a transverse section of the neck here right now. When you take a transverse section of the neck, this is how the diagram looks like. This is how the diagram looks like. And in this, first of all, let us see the arrangement of all the structures. So for 2 minutes, everyone just listen here right now. Then we're going to draw this diagram. In the transverse section of the neck, guys, first of all, this will be the cervical vertebrae. In the neck will be having cervical vertebrae. And that cervical vertebrae will be surrounded by muscles. And anteriorly here will be having trachea. And trachea ke aage, in front of the trachea will be having a gland, and that gland will be thyroid gland. And behind the trachea you'll be having esophagus here right now. So there will be trachea ke piche, behind that will be esophagus, and in front of the trachea will be having thyroid gland. And now the important thing that I'm trying to teach you here is, in the neck region you'll be having fascia. Obviously we all know in our entire body below the skin you'll be having superficial fascia. But in the neck region, not only superficial fascia, you'll also have the deep fascia. So in the neck you'll be having superficial fascia as well as deep fascia. Now we are concerned about the deep fascia of the neck. The deep fascia of the neck will be modified into 4 things. Let us see one by one right now, guys. Number 1, the deep fascia will be modified into this fascia here, this yellow colored one. And this will be known as the prevertebral fascia. Prevertebral fascia. And then there is one more fascia which is surrounding the thyroid gland here right now, guys. And this fascia will be the pretracheal. Trachea ke aage, pretracheal fascia. So prevertebral and pretracheal fascia. And now once you are done with this one here right now, just observe this very, very carefully. Surrounding the entire neck you'll be having like a red colored fascia here right now, and this one will be the investing layer. Surrounding the entire neck will be having investing layer, and this investing layer is going to split here and enclose this muscle, and that muscle will be your sternocleidomastoid muscle, and here you'll be having sternocleidomastoid muscle. And here you'll be having the trapezius muscle, and here you'll be having the trapezius muscle. Okay. So this layer, the red colored one outside here right now, investing layer, done. And the last and final modification, this sheath here is known as a carotid sheath, guys. So I'll repeat all these things for once, last and final time, sir. The deep fascia in the neck is modified into 4 things. Number 1, there will be prevertebral fascia, and then pretracheal fascia, and then this red colored one surrounding here right now is investing layer, and this fascia here is the carotid sheath. So let us draw this diagram of the transverse section of the neck. Let me draw it properly. Imagine this is the transverse section of the neck, and then here this will be the cervical vertebrae, and this cervical vertebrae surrounding the muscles will be surrounded by a fascia, and this fascia here will be the prevertebral fascia. And in the front here there will be trachea, and just behind the trachea there will be esophagus, and in front of the trachea you will be having a gland here, and this gland here in the front will be the thyroid gland. And this thyroid gland will be surrounded by one more fascia, and this fascia here will be the pretracheal fascia. pre-vertebral fascia, and then there'll be pre-tracheal fascia. And I told you in front here right now, in the front of the neck here, there will be a muscle here, sternocleidomastoid, and then here also the same thing, there'll be a muscle here, and that will be sternocleidomastoid. And then behind here there'll be a muscle here, that will be trapezius, and then behind here there'll be muscle here, and that will be trapezius. And now there is a fascia surrounding the entire neck. Now this fascia which is surrounding the entire neck here, this one will be the investing layer. And the last and final thing here right now will be the carotid sheath. This will be the carotid sheath here right now. Okay. So these four things that we have written here, the investing layer, the pretracheal fascia, carotid sheath and the prevertebral fascia, all these are the modifications of deep cervical fascia. So deep fascia of the neck will be having like 4 modifications, and these 4 modifications are on the screen. Why is the issue of password coming right now? It's already logged in, right? Hello everyone, just confirm me. Are you able to listen to my class? Perfect. We are already logged in. What is the problem with the password? Perfect. चलो हो गया. This diagram is done. Sternocleidomastoid fascial. SCM stands for sternocleidomastoid muscle here. This one. If you turn your face here like this muscle here, right? Sternocleidomastoid. Now once you're done with all these things right now guys, now out of all these things for your MC exam, the important topic here that we need to discuss is about the carotid sheath, right? Now please write on the heading there as the carotid sheath. Carotid sheath. Now in carotid sheath, for example, if this is the carotid sheath here right now guys, in the last diagram it was actually the transverse section. Now I am drawing the complete carotid sheath. In the carotid sheath guys, there will be like 2 walls. There will be one anterior wall and then there will be a posterior wall of the carotid sheath. There will be an anterior wall and then there will be a posterior wall. The posterior wall, do one thing guys, just look at this diagram here right now. if this is the carotid sheath here right now, this posterior wall here right now will be contributed by prevertebral fascia. Everyone, I request you to please look at the screen, otherwise you don't understand this. You will not understand this. The posterior wall will be contributed by prevertebral fascia, whereas the anterior wall here right now will be partly contributed by investing layer and partly contributed by pretracheal fascia. So just let us write down this here right now in the notes. Posterior wall is contributed by prevertebral fascia, and then the anterior wall is contributed by the pretracheal fascia as well as investing layer. So the anterior wall will be contributed by both this investing layer as well as pretracheal fascia. Next one. Once you're done with the walls, the next thing will be the contents. What will be the contents of carotid sheath right now? What happens here is that there is one common carotid artery going up, and this common carotid artery will give a branch, that is external carotid artery coming out, and then further it will continue as the internal carotid artery. So you can clearly see in the diagram there, number one content will be common carotid artery, and number two content will be internal carotid artery. Not only this, we'll be even having a vein here right now, guys. The vein which is going to drain the blood from your head and neck, obviously. What is the vein draining the blood from head and neck, sir? Jugular vein. And this will be internal jugular vein. So content number 3 here will be internal jugular vein. And the last and final thing, in between the two, there is the artery and the vein. You'll be having a nerve here right now, and that nerve will be the 10th cranial nerve, that is your vagus nerve. So write down the content number 4 will be the vagus nerve, the 10th nerve. Fine. So that is all you have to remember regarding the carotid sheath. So remember the anterior wall, remember the posterior wall, and then remember about the contents. Contents will be having the common carotid artery, internal carotid artery, internal jugular vein, and the vagus nerve. All these will be the contents of the carotid sheath. Done. Now once you're done with this topic here right now, the next topic that we need to learn is about the external carotid artery. External carotid artery, just now I told you, it is a branch of common carotid artery. External carotid artery, it's a branch of common carotid artery. The next thing that we need to learn, what are the branches given by the external carotid artery? Remember, there are totally 8 branches given by the external carotid artery. 8. Keep on writing. Number 1, superior thyroid artery. Number 2, lingual artery. And number 3, facial artery. Okay. So external carotid artery will give 3 branches, that is your superior thyroid artery, lingual artery to the tongue, and facial artery to the face. And remember, all these 3 arteries are given in the front. They are given in the front, ventral branches. So these 3 will be the ventral branches. Okay. After that, the branch number 4 here will be the ascending pharyngeal artery. Ascending pharyngeal artery. And now, my dear friend, this is like very much important thing. Why? Because look here right now, external carotid artery will be on the sides here right now, and the pharynx is in the middle. So external carotid artery will give the ascending pharyngeal branch, that is towards the medial side. Why? Because pharynx will be in the middle side. So remember, this is extremely important nowadays in the exam. This is the only medial branch. So I'm done with the branches given in the front, ventral branches, and branch on the medial side. Now let us see dorsal branches, PJ. Number 5, you'll be having posterior auricular artery, and number 6, there will be occipital artery. And guys, from the name itself, you can understand here right now, these two arteries, the posterior auricular artery and occipital artery, these two arteries will be posterior auricular and occipital going behind. So therefore, this will be dorsal branches. Dorsal branches. And finally, the number 7 and number 8. Yes. External carotid artery will go and end by dividing into two branches, and those two branches will be ending branches, maxillary artery, and then you'll be having superficial temporal artery. Maxillary artery and superficial temporal artery, and these two will be the terminal branches. So in total, external carotid artery will give you how many branches, guys? 8 branches. You have to remember that. You have got like 3 ventral branches: superior thyroid artery, lingual artery, and facial artery. Ascending pharyngeal artery, pharynx will be in the middle, so therefore medial artery. And posterior auricular occipital artery are dorsal branches, PJ, and it is ending by giving like 2 branches, the maxillary artery and superficial temporal arteries. Okay. Now, out of this, recently one more question was there, sir. Out of all this, which is the first branch? The first branch of the external carotid artery will be superior thyroid artery. Superior thyroid artery will be the first branch. And tell me which is the largest branch? The largest branch will be the maxillary artery. So maxillary artery will be the largest branch. Done. So we are done with all the 8 branches of the external carotid artery, and this topic is done, sir. So in these topics now, there's not like much concept. All the conceptual things I told you before the break. In this topic, it's like more of your work. You need to memorize all the branches. And whatever questions possible, I told you. Now the next topic that we need to learn is about the maxillary artery. So please write on the heading as maxillary artery. Now the next topic that we are going to learn here, that is maxillary artery. Point number 1, maxillary artery, it is a branch of external carotid artery. Wow. So just now we have seen that maxillary artery, guys, it is a branch of external carotid arteries. Next one, it is divided into 3 parts by lateral pterygoid muscle. Okay. So maxillary artery will be, divided into how many parts? Is 3 parts into by which muscle? Lateral pterygoid muscle here. Do you remember our upper limb topic that we have discussed? In the upper limb topic, we have discussed about the axillary artery. And axillary artery will be divided into how many parts? Is 3 parts. By which muscle? Pectoralis minor muscle. Pectoralis minor muscle will divide the axillary artery into 3 parts. Similarly, maxillary artery will also be divided into 3 parts by which muscle? Lateral pterygoid muscle. Okay. And now we need to learn what are the branches given by the maxillary artery, and that was one of the recent question asked in MCA exam, last December exam. Last December exam, there is a question from the branches of maxillary artery, so padna zaruri hai, you have to learn. And now we have to learn the branches given from the all the 3 parts, first part, second part, and third part. So my dear friends, keep on writing. iPad is asking some question here. What is the origin of external carotid artery? External carotid artery, I told you already, it is a branch of common carotid artery. Now let us learn what are the branches given by the maxillary artery from first part. As I told you, now no more conceptual things. You need to, memorize all these branches now. So please try to memorize these branches. First part. Accessory meningeal artery, and then there'll be anterior tympanic artery, and then deep auricular artery, middle meningeal artery, and inferior alveolar artery. So accessory meningeal artery, anterior tympanic artery, deep auricular artery, middle meningeal artery, and then inferior alveolar artery. Please make a note of this one. Now try to recall from yesterday's class, accessory meningeal artery is going to pass through foramen ovale. Remember the mnemonic as male? Yes, A for accessory meningeal artery. And try to recall from yesterday's class, middle meningeal artery is going to pass through foramen spinosum. So that is why it is important. So yesterday I just told you about those branches, and today they are coming from, yes, they are the branches of first part of the maxillary artery. So first part of the maxillary artery is giving this branch. Okay, and done. Now the second part. Second part will be giving the branches. This is like easy branches, guys. These are the branches given to all your muscles of mastication. What are the four muscles of mastication we have learned yesterday? Masseter, lateral pterygoid, medial pterygoid, temporalis. So there is one artery to medial pterygoid, one artery to masseter, artery to lateral pterygoid, artery to medial pterygoid and masseter, and then there will be two arteries which are to temporalis, two deep temporal arteries. Okay. Second part, little bit easy branches. And now once we are done with the second part branches, guys, welcome to the third part branches. The branches given by the third part here, yes, there are so many of them. Posterior superior alveolar artery, inferior orbital artery, greater palatine artery. Posterior superior alveolar artery, inferior orbital artery, and then greater palatine artery. Then remember pharyngeal artery, artery to pterygoid canal, and sphenopalatine arteries. Pharyngeal artery, artery to pterygoid canal, and sphenopalatine artery. And if you now count them, there are totally 16 branches, sir. 5 branches from first part, 5 branches from second part, and there will be 6 branches from the third part. So in total, 5 plus 5, 10, 10 plus 6, 16, 16 branches will be there. And you have to learn that. Now, once you're done with this one, what are the questions asked here right now, guys? Question number 1, out of all these 16 branches, this one is the largest branch. Out of the 16 branches, this is the largest branch. So, which is the largest branch? Sphenopalatine artery. And do you know what is the another name of sphenopalatine artery? It is also known as the artery of epistaxis. Artery of epistaxis. What is the meaning of epistaxis? Bleeding from the nose bleeding. So there is an artery of epistaxis. Okay, sphenopalatine artery. So these questions has been already answered. Sure, that's done. So that is the reason. I hope now you're understanding my complete planning here right now, guys. Everything conceptual topics like vagus nerve, pharynx, larynx, and everything I've completed before the before this break there. And now this is like memorizing, so that is can't be helped out. So you need to memorize. Second part branches you can see. You done? Sure. Now once we're done with this one right now, guys, so we are done with all the the high yield topics of head and neck, and now let us do one thing here right now. Let's discuss about the embryology part of the head and neck, sir. So please write on the heading as head and neck embryology. Head and neck embryology, guys. So now, my dear friends, get set ready. Definitely there will be like 2 or 3 questions from this topic in every MC exam. Without question from this topic, MC exam will not be done. So let's get set ready right now. So after doing some simple topics right now, guys, let's begin with the conceptual one again. Let's begin with the head and neck embryology. Head and neck embryology. Now in this diagram of the embryo, okay, you can see here, this is the face of the embryo here right now, guys. Someone is asking, MBA, Holi wale din bhi class? Yeah, no problem. Enjoy the Holi the whole day. Even I will enjoy. मैं भी सेलिब्रेट करता हूँ, तो दिन भर एंजॉय करना, शाम को आ जाना क्लास के लिए. और फिर 6th विल बी क्लास. सो हेलो, ऑलरेडी आई हैव इन्फॉर्म्ड इन द ग्रुप. मैंने ऑलरेडी ग्रुप में इन्फॉर्म किया है. ओके, अगर हमारा सिलेबस हो जाता है इन टाइम, तो देयर इज़ नो रिक्वायरमेंट ऑफ द क्लास ऑन 6th. ठीक है. And I think till now we are done with the neuroanatomy topic. We are done with the upper limb topic. We are done with thorax. We are done with general embryology. है ना, head and neck. Now the only thing that is left out right now will be the lower limb and the abdomen and pelvis and perineum. ठीक है ना. Lower limb, abdomen and pelvis and perineum. So lower limb will be done tomorrow and abdomen, pelvis and perineum probably will try to complete tomorrow, a day after tomorrow. Okay. So we will see if it is not required, then directly we will finish it off. Otherwise we'll have to take one more class. Okay. I already have clarified that in the group also. Yes, joints bhi ho jayenge. That joints and everything will be a part of your general anatomy and physiology. Chalo sir. Now please look at this diagram here right now, guys. In this diagram you're able to find this is the developing head and neck in the face, and this diagram will be, or this part will be the upper limb, and from here develops the lower limb, and here will be your developing heart that I taught you yesterday, development of the heart. And now our topic right now is this part right now, and this will be the pharyngeal arches. This will be the pharyngeal arches, and that's something very important topic for your MC exam. That is what we are going to learn. So try to imagine the embryo. Embryo is having the head and neck here, and this is the pharynx part, and here you'll be having the pharyngeal arches. Pharyngeal arches. चलिए इसके बारे में study करते हैं. So basically our concentration is here right now, guys, this part. Now in this part, guys, look at this diagram here. This will be the pharyngeal arches here right now, and what we are doing right now is that we are going to cut the embryo along this line. Now what is that section of the embryo? We are going to cut the embryo coronal section and then see from the front. हम आगे से देखेंगे. When you are trying to see from the front, my dear friends, yes, first of all tell me what is the germ layer on the outer side. Outer side will be having ectoderm, and outer side will be having ectoderm. And what is the germ layer on the inner side? On the inner side will be having, and will be having endoderm. And whatever this in the middle that you are able to see here, this yellow colored one will be mesoderm. Mesoderm. So here the starting planning is important here right now, guys. Outer, this red colored one here is ectoderm. Outer red colored one is ectoderm. On the outer side will be having what? You'll be having, and then in the middle you'll be having what? Mesoderm. So चलिए मैं आपको बताता हूँ what is going to happen with this one here right now. Just want to be the ectoderm here. The black colored line to be the ectoderm here. And imagine this inner red colored line to be the endoderm. And in the middle you'll be having another third germ layer, that will be a mesoderm here. So let me just write down here. This will be the ectoderm. This will be the endoderm. And this here will be the mesoderm. Ectoderm, endoderm and mesoderm. ठीक है, done. And now once you are done with this ectoderm, endoderm and the mesoderm, now move in, whereas endoderm will evaginate outside. Endoderm बाहर की तरफ में जाएगा. I repeat again, ectoderm will evaginate inside and endoderm will evaginate out. It will go out. So therefore let me tell you the further diagram. So further development क्या होगा? I'm using the same color here. The black colored line is ectoderm. Ectoderm is going to move in 1, 2, 3, 4. Done. Now what is this invagination known as here? This is known as the ectodermal cleft. They are known as ectodermal cleft. Now if you are done with the name, guys, ectodermal cleft. Now how many ectodermal clefts do you have? 1, 2, 3 and 4. There will be totally 4 ectodermal clefts. And you cannot change this name. It has to be like cleft only, guys. Ectodermal cleft only. It should be cleft. Now what about the inner one, sir? That red colored one will be nothing but your endoderm. And endoderm is evaginating out. वो बाहर की तरफ में जा रहा है. So the endoderm will be evaginating out. ठीक है? And this evagination of the endoderm is known as endodermal pouch. Endodermal pouch. And how many endodermal pouches do you have again? Again, you'll be having like 4 endodermal pouches, guys. Wow. So by this we remember, okay, ectoderm is going to form what's a cleft, and endoderm is going to form what's a pouches. That's important. This question has been already asked in the MCI exam. Okay, ectoderm is going to form what's a cleft, and endoderm is going to form what's a pouches. Is it okay? Now what is left out here in the middle? In the middle we are left out with this mesoderm in the middle, and this mesoderm is the one which is going to form your favorite, the pharyngeal arches. Every time students will be learning this one thing only, pharyngeal arches. Pharyngeal arches. Okay. So my dear friends, actually remember, how many pharyngeal arches do you have? Little bit be careful here right now. There will be 1, then 2, then 3, and then 4, and then this one will be 6. Actually there will be a 5th month also present, but during development the 5th month will degenerate. Is it okay? So pharyngeal arches will be like 1, 2, 3, 4 and 6. The 5th month will degenerate during development. Understood? So first you should be perfect with these 3 words, these 3 terms. Which 3 terms, guys? Ectodermal cleft, endodermal pouches, and the mesoderm is going to form what? Arches. I repeat again for the last and final time. Remember, ectoderm is going to form cleft, endoderm is going to form pouches, and then mesoderm is going to form what, sir? Arches. And remember, actually now, when you study in your textbooks, embryology textbooks, okay, actually the name is like pharyngeal cleft, pharyngeal pouch, pharyngeal arch. I repeat again, pharyngeal cleft, pharyngeal pouch and pharyngeal arch. Pharyngeal cleft, pharyngeal pouch and pharyngeal arch. But wantedly what I have done is I have changed the name as ectodermal cleft, endodermal pouch, so that my students can remember that cleft will be ectodermal, pouch will be endodermal. Hope it is done. Very good. Now once you are done with this one right now, guys, we need to just learn. What do you have to learn here right now? You need to just learn here, okay, what are the derivatives right now, sir? What is derived from each and every part? What will be derived from the 4 ectodermal clefts, and what will be derived from the 4 endodermal pouches, and then what will be derived from the arches? So you learn that. Okay, done. चलो सर start करते हैं. See, actually now what is, it is like very easy actually. What to do here is that right now, you know, this diagram just apply on your body. We are dealing with the which region? Pharyngeal region. Pharyngeal region, outside what do you have here? Ectoderm. Guys, listen these things very, very carefully. Why? Because whatever I'm going to tell you right now, it's not given in your books. We need to apply how to learn this topic. Apply this on your body here. Ectoderm. Ectoderm is moving in, and those ectodermal clefts, you will be having the first one, the second one, the third one, and the fourth one here. Now the first one which is moving in is going to form your external acoustic meatus here. The first one is going to form external acoustic meatus, whereas the second, third, and the fourth will be completely closed. Look at this diagram here right now. In this diagram, this is ectoderm here right now, guys. And ectoderm, the first one is going to form external acoustic meatus, external ear, and the second and third and the fourth, second, third, and the fourth are obliterated, they are closed. So my dear friends, the first ectodermal cleft, I am repeating for the last time, the first one is going to form external acoustic meatus, whereas the second cleft, the third cleft, and the fourth cleft are completely closed because of this overt course. Okay, that's all. Okay, it's easy. In the exam, they will ask you external acoustic meatus is derived from where? First cleft. Okay. So chalo sir, let us start writing now. Now guys, if you want you can draw the diagram again, but I am going to do it in the same diagram here. Ectodermal cleft. Now let us learn what are the derivatives. और यहाँ पे लिखता हूँ मैं derivatives of ectodermal cleft. The first ectodermal cleft is going to form the external acoustic meatus. The first ectodermal cleft is going to form external acoustic meatus. The second, third, and the fourth. Come on, tell me what is going to happen to the second, third, and the fourth. The second, third, and the fourth, these will be obliterated. What is the meaning of obliterated, sir? It will be closed, sir. Okay, done. I am done with the first topic. Welcome to the second topic right now. On the other side, let's see what is the derivatives of endodermal pouches. Now what will be the derivatives of the endodermal pouches, guys? Are you ready? See, common sense here right now. First of all, try to apply your common sense here right now. If this one is your first ectodermal cleft, it is forming external ear. If it is forming external ear, now this is coming and meeting here. If it is coming and meeting, definitely that will be which ear? Middle ear. So therefore, the first endodermal pouch is going to form the middle ear cavity. Not only middle ear cavity, along with the middle ear cavity, it is also going to form eustachian tube. I hope you know about the eustachian tube. Eustachian tube will be attached to which ear only? See, in the ear you will be having three parts: external ear, middle ear, internal ear. External ear, middle ear, internal ear. And out of the three parts, remember eustachian, it will be attached to the middle ear. So common sense, if middle ear cavity is derived from here, obviously what is going to be derived along with that one? Eustachian tube also. Wow. So it makes some sense right now. So therefore our external ear will be derived from outside, first ectodermal cleft, and the middle ear will be derived from the endodermal pouch, first endodermal pouch. After that, thoda sa niche, okay na, after the middle ear, thoda sa niche here, the second pouch is going to form palatine tonsils. Palatine tonsil. So direct questions will come from here. Palatine tonsils will be derived from where? Second pouch. And the third pouch is going to form thymus. So it's quite easy to remember. Remember with the rhyming word, third thymus, and along with thymus, what is going to be derived from here? Inferior parathyroid gland. Okay? Because after the formation here, the thymus gland will go down. Along with thymus, what will go down? Inferior parathyroid gland. Then obviously what is derived from the fourth pouch? From the fourth pouch will be the superior parathyroid gland. Superior parathyroid gland, sir. Wow, it's done. Okay, bachcho. So my dear friends, it will be so easy. Just try to practice this once or twice, it will be done. This should be actually applied here in this part, pharyngeal part. अगर आप यहाँ पर अप्लाई करोगे टॉपिक आपका आसान होगा, वरना उतना ही डिफिकल्ट होगा. So what will be derived from the ectodermal cleft? Ectodermal cleft, the first one, first cleft, external acoustic meatus. Second, third, and fourth will be closed. What will be derived from the endodermal pouches? Endodermal pouches, come on. The first pouch, the medullary cavity and eustachian tube. The second pouch, palatine tonsil. Third pouch, thymus along with inferior parathyroid. And the fourth pouch will be superior parathyroid gland. And now let me clear 2 points here right now, sir. Point number 1. In most of the embryology books, what they have given is that along with superior parathyroid gland, one more thing here, that is ultimobranchial body. Ultimobranchial body. And my dear friends, that is creating a lot of controversy. Why? Because it's given wrong in many books. Remember, what is this ultimobranchial body representing? एक बार लिखो और clearly लिखो sir. Ultimobranchial body ना इसके साथ में लिखा है यहाँ पर. But remember, ultimobranchial body is not from here. Ultimobranchial body is remnant of fifth arch. Try to think about that. Come on guys. Ultimobranchial body is the remnant of which arch, guys? Fifth arch. Try to think about that. I told you already, arches is the name for ectoderm, endoderm or mesoderm? Arches is the name given for ecto, endo or meso. Arches is the name for ecto, endo or meso. Very good. अब ध्यान से देखो, अगर आप mesoderm देखोगे, if you look at the mesoderm in the middle, I wrote here 1, 2, 3, 4 and 6. And I told you fifth one will be gone. And that fifth one, the remnant of that is known as the ultimobranchial body. I'm telling you very clearly, I wrote here very clearly. Please don't ask me again and again. It is given wrongly in many MCQ books. And that is the final answer, guys. This is the final answer here right now. So the fifth arch that is going to be remaining as ultimobranchial body, that is the final answer given in almost every international edition of embryology book. Like for example, Langman's embryology, it's very clearly given. So please don't try to create the controversy again and again. Now that completes our 2 topics here right now, guys. I'm done with the ectodermal cleft and endodermal pouches, guys. Okay? I'll give you 2 minutes of time. First revise this and then we'll go to the last topic, that is arches. Pharyngeal arches. Revise this right now, sir, quickly. No, it is not like vestigial, it is having some function. Neural crest cells will come there and they'll sit on that one and they'll be multiplying, they'll be giving many things. It's not vestigial, it is having some functions in other parts. Any more doubts? Neural crystals, I told you we are going to study that later on. It will come in another topic. iPad, you are writing it wrongly there. Mesoderm don't form anything else except pouch. Pouch is not formed by mesoderm. Pouch is formed by endoderm. I wrote there very clearly. If you are doing that blunder, it's a blunder. Gurshin, she is writing there. He. Superior parathyroid, isn't it right? Fourth pouch. I'll tell you once clearly. Fourth pouch is going to form superior parathyroid gland. Third pouch is going to form thymus along with inferior parathyroid. Any more doubts? Pranaja, I told you it is not pouches, arches, and we are going to discuss that. First finish this. Chalo guys. Now if you are done here right now guys, everyone observe here right now. Now welcome to the last and final thing here right now guys. We need to learn about the arches. Now once you're done with this one right now, the last and final topic that is left out is arches. Let us learn about the arches right now, sir. Mesoderm. Now my dear friends, pharyngeal arches this is a little bit bigger topic, so please concentrate here. First try to learn what is the nerve supplying to the pharyngeal arches. You'll be having arch number 1, arch number 2, arch number 3, arch number 4 and 6. Okay, so pharyngeal arches will be having like 1, 2, 3, 4 and 6. No, this is not the last topic for today. Pharyngeal arches will be 1, 2, 3, 4 and 6, which is formed from where, sir? Mesoderm. What you have to learn, the first thing is what is the nerve supplying to this arches. Which nerve will be supplying to each and every arch. Pharyngeal arch number 1, it will be supplied by 5-3 mandibular nerve. Pharyngeal arch number 2, it will be supplied by facial nerves. And arch number 3 is supplied by 9th cranial nerve, that is glossopharyngeal. 4th one will be supplied by superior laryngeal nerve, and 6th is supplied by recurrent laryngeal nerve. And today only I taught you these two are the branches of vagus only. Are you all done? So guys, pharyngeal arches, we need to learn about which nerve is supplying to that arch first. First you need to memorize this one. So repeat again, which nerve will be supplying to the first arch? 5-3. Mandibular nerve will be supplying to the first arch. Facial nerve will be supplying to the second arch. Glossopharyngeal nerve will be supplying to third arch. Superior laryngeal and recurrent laryngeal, they will be supplying to fourth and sixth arch. I'll tell you the use of these nerves later on. Don't worry about that. First you need to learn which nerve is supplying. Now once you are done with the nerve supply, then you have to learn what guys, the derivatives. So let us learn the derivatives. Now my dear friends, remember what is the nature of these pharyngeal arches? Are they made up of ectoderm, endoderm or mesoderm? They are made up of mesoderm. And I hope you all know that mesoderm is going to form your bones, ligaments, muscles, all of them are derived from where? Mesoderm. So we need to first learn about the bones and then we'll learn about the muscles. ठीक है ना? तो पहले हम लोग पढ़ेंगे which bones and cartilages, the skeleton part, what is derived from that. First we'll learn the skeleton part, bones and all. And how will it become easy? That becomes easy with the help of this diagram here. Now please look at this diagram here right now guys. So in this diagram, you know, whatever is highlighted here in the orange color here right now guys, all this will be derived from the first arch. First arch. Whatever is highlighted in the blue color here will be, you know, derived from second arch. Whatever is highlighted in yellow color here by third arch, and then, you know, fourth arch, then fifth. So what I am trying to tell you here is that our entire face here, it is like, you know, derived layer by layer. First arch, second arch, third arch, fourth arch, something like that, you know. So it is derived by layer, our entire face here right now. So let us keep all these things in mind and then start writing the notes here right now, sir. So लिखना शुरू करो. Draw the table again. Pharyngeal arches, and then on the other side I'm going to write down the derivatives. The first pharyngeal arch is going to give rise to what? Listen here. How many ear ossicles do you have? The bones in the ear, you'll be having 3 of them: malleus, incus and stapes. Try to remember like this: S for stapes, S for stapes, and S for second arch. Malleus, incus and stapes, S for stapes, S for second arch. That means stapes derived from where? Second arch. Stapes is derived from where? Second arch. And now my dear friends, what is left out? Malleus and incus. So malleus and incus will be derived from first arch. Not only that, there will be anterior ligament of malleus, and not only that, there will be one more sphenomandibular ligament, and we have almost come to the level of mandible. So therefore even mandible and maxilla, all this will be derived from the first arch. Okay, so malleus and incus, anterior ligament of malleus, sphenomandibular ligament, mandible and maxilla, everything here. So let me just explain you that with the help of this diagram here. Yes, malleus and incus. In the front of malleus there will be a ligament, anterior ligament of malleus. Inside will be having a sphenoid bone, sphenomandibular ligament. And then which bone here right now? Mandible. And which bone here right now? Maxilla. So each and everything here will be derived from which arch, sir? The first arch. I repeat for the last and final time guys. Malleus and incus, anterior ligament of the malleus, sphenomandibular ligament from the sphenoid bone to the mandible, and then mandible and maxilla. Everything here will be derived from which arch? First arch. That is done. Now once you're done with the first arch, welcome to the second arch right now, guys. What is derived from the second arch? Already you people know about one bone that is derived from the second arch, that is stapes. I told you S for stapes, S for second arch. After that, do one thing here right now, guys. There will be, styloid process here, behind here, styloid process. And there will be styloid process. And then here you'll be having the hyoid bone. Greater horn, lesser horn, body, lesser horn, greater horn. And from here, the styloid process to the lesser horn, there will be a ligament here right now. Say. Okay? Styloid process, and then there will be ligament up to the hyoid bone. So, pehle naam likhte jao, keep on writing. What is the name of this process? Styloid process. Okay. What is the name of this ligament? Obviously, stylohyoid ligament. Okay. And then here what you do is mark a line here like this, guys. I mean to say only the lesser horn and only the upper part of body of hyoid bone. Oh my god. Only the lesser horn and upper part of the body of the hyoid bone, sir. So somehow what will happen, this diagram will this diagram will actually stick in your mind. Instead of just mugging up all the derivatives just in the form of a paragraph, better with the help of a diagram. Styloid process, stylohyoid ligament, upper lesser horn and only the upper part of the body, sir. All this will be derived from which arch only? Second arch. This is derived from second arch. And if you want to just cross check, look at this diagram here right now, guys. Hello. Now in this diagram you are able to see, yes sir, stapes, styloid process, and then there will be a stylohyoid ligament, and then this stylohyoid ligament you can see very clearly here, only the lesser horn and upper part of the body. All this in the blue color will be derived from your which arch? Second arch. Okay, perfect. Now I think you understood the strategy here right now. Now you yourself can tell me what is derived from the third arch. Third arch, whatever is left out below. Come on. What is left out below? What is left out below? Come on, tell me. Yes. So from the third arch, what is derived? Greater horn. And not only the greater horn, sir, and lower part of body of hyoid bone. That's all. That is only derived from third arch. So it's like becoming a little bit easier, right? So first many bones and ligaments, second many bones and ligaments, third one only this one, sir, only the greater horn and lower part of the body. Acha yaar, ye batao, after hyoid bone what do you have here? After hyoid bone we'll be having what only? Larynx. Today only we have drawn the diagram before the break. After hyoid bone, larynx will be there. And what is larynx made up of? Cartilages. And all that cartilages definitely should be derived from where only? The fourth and sixth arch. The fourth and sixth arch are going to give rise to all cartilages of larynx. Khatam sir, ho gaya. Are you okay with this one here? So don't worry about that diagram, guys. That diagram I'll actually forward you people. Now first of all what you do is try to learn this right now. First of all try to just revise this. I'll give you 1 minute of time. Come on, revise. It's like layer by layer. चलो सर हो गया. Are you all done? Now once you're done with this one guys, if you're observing here right now very carefully, I'm done with what here right now guys, I'm done with the bones and ligaments. I'm done with the bones and ligaments. And once we're done with the bones and ligaments right now, now let us learn about the muscles. Let's see the last and final thing right now in this topic. What are the muscles derived? So the pharyngeal arches, again make the last and final table sir, pharyngeal arches. And then which nerve is going to be supplying to that one. I'll tell you what is the role of nerve now. Arch number 1, it will be supplied by which nerve? We already know it will be supplied by mandibular nerve 5-3. And now let us see what will be the muscles derived. Bones and ligaments are made easy with this diagram, hai na? Don't worry about these diagrams, I'll forward you. Bones and ligaments are easy with this diagram. And now let us make the muscles easy right now. How to make the muscle easy? The only and only logic here, the trick here is that the nerve, mandibular nerve is going to supply to whatever muscles, all those muscles will be derived from first arch. I repeat again, what are the muscles derived from first arch? Each and every muscle that is supplied by mandibular nerve. Come on, recall since yesterday whatever we have learned, which muscles will be derived from here? Come on. Mandibular nerve will be supplying to muscles of mastication, okay? Not only the muscles of mastication, today we have learned, yes, come on. Today we have learned mandibular nerve will be supplying to which muscle? Tensor veli palatini. And there is one more in the ear, and in the ear we'll be having tensor tympani. I will tell you one golden rule guys. Whenever you see the word as tensor muscle, whenever you see the word as tensor muscle in the exam, MC exam, just mark the answer as first arch. There is no other arch from where tensor muscle will be derived. Are you okay? Okay, come on. Tensor veli palatini and tensor tympani, all these two tensors will be derived from where sir? They will be derived from the first arch. Not only that, there will be anterior belly of digastric here, anterior belly of digastric muscle. Along with the anterior belly of digastric muscle, there will be mylohyoid always. So remember these two tensors together, and along with the anterior belly of digastric always there will be mylohyoids. So all these muscles will be derived from which arch sir? The first arch. First arch से सारे muscles derive होते हैं. Done, done, done. So the hint here is that, you know, the nerve, mandibular nerve, the mandibular nerve guys, okay? So mandibular nerve will be supplying to whichever muscles, and all those muscles will be derived from the first arch. Now welcome to the second arch. Arch number 2 will be facial nerve. What is the nerve supplying to arch number 2? Facial nerve. So it is a facial nerve here right now guys. Now tell me what will be the muscles derived from here? Come on. Muscles of facial expression. All the muscles of facial expression. Along with that, which muscles will be now? Posterior belly of digastric. And along with the posterior belly of digastric, always there will be stylohyoid muscle. So these two should always go together. So here it is anterior belly and here it is posterior belly. Anterior belly of digastric will be along with mylohyoid muscle, and posterior belly of digastric will be along with the stylohyoid muscles. Okay, and not only this one here, come on sir, हो गया? And then the posterior belly of digastric and the stylohyoid muscles. And then one more thing, you remember facial nerve? Facial nerve will be supplying to one more muscle in the ear. In the ear, it will be supplying to stapedius. In the ear, it will be supplied to stapedius. So, my dear friends, remember this. In the ear, tensor tympani, and in the ear, one more muscle, stapedius. So, this is in the ear, and this is in the ear. Tensor tympani in the ear is derived from first arch, whereas stapedius will be derived from which arch? The second arch. Now, once we are done with this one here right now, sir, after that it is easy here right now. The third arch number 3, what is the nerve supplying to that? Glossopharyngeal nerve, and we all know only one muscle, stylopharyngeus muscle will be derived from here. Glotso, and that will be stylo. Ho gaya. That's only one muscle derived from there, sir. So it's easy to remember. What is the hint I told you? What is the hint there, sir? Hint will be nerve. That nerve is supplying to whichever muscle. That muscle will be derived from here. So today only we learned stylopharyngeus muscle को style मारना होता है, और style मारने के लिए क्या चाहिए? Gloss, and therefore glossopharyngeal nerve will be supplied to that. And after that, the last and final one, the fourth and sixth arch. Come on, guys. The fourth and sixth arch. It will be supplied by which nerve? 10th one, vagus. And vagus, what will the muscles derive from here? Come on, today only I taught you. Vagus nerve will be supplying to muscles of larynx, muscles of pharynx, and muscles of palate. Muscles of larynx, pharynx, and palate will be derived from the fourth and sixth arch. That completes the entire topic here right now, guys. Done. So ectodermal cleft, easy. Endodermal pouches will be easy, but arches will be actually a big topic, and many questions will come from here. And one more thing, remember, you have to remember at least about the first and second arch very perfectly. Why? Because most of the time what I have seen is that most of the questions will be coming from the first arch and second arch. First arch and second arch. So first and second arch you have to remember very perfectly always. And there will be definitely one question coming from this topic. Development of head and neck development. One topic definitely, one question definitely comes from. Is it okay, guys? And this completes about the cleft function of SLN and RLN, superior laryngeal nerve and recurrent laryngeal nerve. Today only I taught you, superior laryngeal nerve is supplying to which muscle, recurrent laryngeal nerve is supplying to which muscle. Chalo, guys. So that completes the head and neck embryology part also. And not only head and neck embryology, sir, we are even done with the gross anatomy of the head and neck, sir. So that completes your complete head and neck topic. I think you people are understanding my planning. I think day before yesterday I taught you about the general embryology, first week, second week, and third week of pregnancy. And after that I told you systemic embryology. I will deal with every topic. तो हमने कल क्या किया? What we have done yesterday, along with thorax we have learned cardiovascular system embryology, and today with head and neck we have done with the head and neck embryology. ठीक है, हो गया. That is done, sir. Fine. So I'll do one thing here right now, sir. I'll give you like 2 minutes of time. Revise this, and then we'll start with the next topic right now. Yes, perfect. Revise this, and we'll start with the next topic quickly. I hope you will are done with the revision part right now, and now let's begin with the next topic. The next topic is the lower limb right now, guys. Yeah, Srinivas, actually, I told you when I told you about the vagus nerve, vagus is actually combining along with the 11th one to form the vago accessory complex. But mainly it is the vagus part which is supplying. So it is contributing to your, the main thing for supplying the nerve supply to the pharynx and palate muscles. So the main nerve there will be vagus nerve, and that 11th is just coming along with that one. So it is vago accessory complex. But here you cannot include the nerve as 10th and 11th. It will be only 10th. Now if everything is clear right now, guys, now let's start with the new topic here right now. Now this next topic here that we are going to begin is lower limb right now, guys. First of all, try to understand the planning here. Lower limb topic I'm going to teach you exactly as I have taught you the upper limb topic is. Lower limb topic exactly like upper limb topic. Just try to recall in the upper limb what you have learned. In the upper limb you have learned about the brachial plexus first. And now I'm going to teach you about the lumbosacral plexus. For the lower limb, lumbosacral plexus. And in the brachial plexus, I told you about the 5 major nerves. The 5 major nerves will be your musculocutaneous, axillary, ulnar, median, radial. Similarly, in the lower limb also will be having 5 major nerves. In the upper limb, they are supplying to arm, forearm, and hand. In the lower limb, they will be supplying to thigh, leg, and the foot. Are you understanding? So upper limb and the lower limb are exactly the same. Exactly same, guys. So let us do, the lower limb topic in the easy manner possible. Lumbosacral plexus. Lumbosacral plexus. The first topic that we are going to learn here right now is lumbosacral plexus, guys. Okay. And now once you are done with this lumbosacral plexus, heading here right now, first thing is origin. It will be originating from right down there L2, L3, L4, L5, S1, S2, and S3. Right exactly in the center of the page. L2, L3, L4, L5, S1, S2, and S3. And now this topic is like so easy. If you remember upper limb topic, when I taught you about the brachial plexus, you remember brachial plexus, there are totally 5 parts. So roots, trunks, division, cords, branches. We studied almost for 1 hour. There are so many branches and all. Now welcome to lower limb, guys. Lumbosacral plexus. It will be done in 2 minutes. Why? No roots, no trunks, no cords, nothing. There will be only division. And you all know how many divisions do we have, guys? 2 division, anterior division and the posterior division. Are you getting a point here right now? That is the reason why lower limb topic is like damn easier. Damn easier. There will be nothing, guys. So only division will be having anterior division and the posterior division. So on this side I am going to write down here as the anterior division, and on the other side let us write down the posterior division, guys. Anterior division and the posterior division. The anterior division of L2, L3 and L4 will combine to form obturator nerve. Anterior division of L2, L3 and L4 will combine to form obturator nerve. Okay, sir. First one. The posterior division of L2, L3 and L4, this will combine to form your femoral nerve. Wow. I'm done with 2 major nerves, obturator nerve, femoral nerve. Now the anterior division of L4, L5, S1, S2 as well as S3, all of them, they will combine to form one more nerve, that is tibial nerve. The anterior division of L4 to S3, L4, L5, S1, S2 and S3, they will combine to form tibial nerve. Whereas the posterior division of L4 to S2 only, sir, be very very careful. L4, L5, S1, S2 only will combine together to form common peroneal nerve. Be very careful, guys. It's only L4, L5, S1 and only S2, not S3. Okay, done. So lumbosacral plexus, anterior division of L2, L3, L4 will combine to form obturator nerve. Let us just revise once more, guys. Anterior division of L2, L3, L4 will combine to form obturator nerve. The posterior division of L2, L3, L4 will combine to form femoral nerve. Anterior division of L4 to S3 will combine to form tibial nerve, and the posterior division of L4 to S2 will combine to form common peroneal nerve. There is a posterior division, but it is not going to combine with this one. But now, if you remember, I told you in total how many major nerves do you have, guys? How many major nerves do you have? 5. But on the screen here you are able to see only 4 of them. On the screen you are able to see only 4 of them. So remember, common peroneal nerve will be in turn dividing into 2. One will be deep peroneal nerve. Another one will be the superficial peroneal nerves. So in this manner, you will be having like totally five, the major branches. That's all. Okay, that completes lumbosacral plexus. So that is the reason why, after learning upper limb topic, the lower limb topic will become damn easy for you. So lumbosacral plexus, that's all done. Are you all done? Now guys, once you are done with this one important thing here is that add below, note करके लिखो इसके below. There's one important nerve that is nothing but your sciatic nerve. There is a nerve that is known as sciatic nerve. And remember, sciatic nerve is actually, it's a combination of 2 nerves. One will be your tibial nerve along with common peroneal nerve. Tibial nerve and the common peroneal nerve. So the tibial nerve along with the common peroneal nerve, these 2 nerves will combine together to form your sciatic nerve. And in the recent one of the exam, they have asked like what will be the origin of sciatic nerve. So can anyone tell me what is the origin of sciatic nerve right now? Just look at the diagram here and tell me what is the origin of sciatic nerve. Sciatic nerve will be actually originating from where to where? Come on. Common sense. If it is like tibial and common peroneal, it will be originating from L4, L5, S1, S2 as well as S3. So therefore its origin will be from L4 to S3. Wow, good. Done. So we are done with the lumbosacral plexus, and then we are done with the concept of sciatic nerve. And once we are done with this concept, guys, now let us go towards the same thing again. As I gave you the golden rule for the upper limb, you remember the upper limb topic is anterior compartment of arm musculocutaneous, here radial, and here radial, then ulnar and median, So similarly, let us make a rule for the lower limb also. Okay. So therefore, my dear friends, let's make the rule for the lower limb. Now please write on the heading as the major nerve. There are in total 5 major nerves. Now let's see how they are supplying to your thigh, to the leg and to the foot. Come on. Now I cannot show you here, so you need to just imagine here right now, guys. So imagine if this is your thigh here right now. The thigh, all the muscles of the thigh will be divided into 3 compartments. All the muscles of the thigh will be divided into how many compartments? 3 compartments. Anterior compartment, posterior compartment and medial compartment. So in the thigh, all the muscles are divided into how many compartments, guys? anterior compartment of muscles, there will be a medial compartment of muscle, and then the posterior compartment of the muscles. Anterior, medial and posterior. And guys, exactly opposite will be in the leg. In the leg, what will happen, you know, you'll be having like again 3 compartments, but one will be anterior, another one is posterior, another one is lateral compartment. So therefore you'll be having one anterior and then lateral compartment and then posterior compartment. If you remember upper limb, in upper limb it's only 2 compartments, anterior posterior, anterior posterior. But in lower limb we'll be having like 3 compartments. So let us do it again. Thigh, anterior, posterior, medial. And in the leg you'll be having anterior, posterior and lateral. In the thigh, anterior, posterior, medial. Whereas in the leg you'll be having anterior, posterior, lateral compartment. And in the foot again same like hand right now guys. In hand, if you remember, all 20 muscles of hand we did not divide into compartment. It's only muscles of hand. In the hand you don't have any muscles behind here right now, only muscles in the front here right now. Similarly, we are not going to divide the muscles of foot into any compartment. Muscles of foot will be simply muscles of foot, no division into compartment. Okay? Now once you have divided that, now let us assign which nerve will be supplied to which compartment. Now that is the golden rule that I am trying to make you learn. Remember, all the muscles in the anterior compartment of the thigh, anterior compartment of the thigh will be supplied by femoral nerve. All the muscles in the anterior compartment of the thigh will be supplied by femoral nerve. And similarly, all the muscles in the medial compartment of the thigh will be supplied by obturator nerve. On the medial side of the thigh will be having adductor muscles. Adductor, bringing the thigh closer. Adductor, adduction. So on the medial side of the thigh will be having adductor muscles, and those will be supplied by obturator nerve. And now what about the posterior compartment? Posterior compartment, all the muscles will be supplied by tibial nerve. Which nerve? Tibial nerve. See, my dear friends, let me just check whether you people are able to recall or not. In the upper limb, entire posterior compartment is supplied by. Can you please answer? In the upper limb, all the posterior compartment is supplied by radial nerve. That's what I am trying to tell you. God has made our body in a very simple manner. Upper limb and the lower limb exactly the same planning. In the upper limb, all the posterior by radial, and in the lower limb the entire posterior compartment will be by tibial nerve. So exactly like radial, you will be having tibial there. So posterior compartment of thigh will be supplied by tibial nerve, as well as the posterior compartment of the leg will be supplied by tibial nerves. Kya baat hai? So it's like posterior. Now if you just look at the lumbosacral plexus, come on guys. I'm done with obturator, I'm done with femoral, I'm done with tibial. Now what is the only thing left out? Which nerve is left out? Come on, which nerve is left out right now? Common peroneal nerve. And that common peroneal nerve, I told you it is going to divide into 2. That is deep peroneal nerve and superficial peroneal nerve. Remember, out of that, deep peroneal nerve will be supplying to the anterior compartment of the leg, and superficial peroneal nerve will be supplying to lateral compartment of the legs. Are you done? So deep peroneal nerve is supplying to all the muscles in anterior compartment of the leg, and then superficial peroneal nerve is supplying to the lateral compartment of the legs. And lastly, we are left out with the muscles of the foot. Now, my dear friends, try to imagine this one to be my foot here right now. My dear friends, look here. Imagine this to be the foot right now. And the foot will have a region below. This one will be plantar. In the hand, this is palmar. And if it is foot, this will be plantar. And this is dorsum. Plantar region and dorsum region. Plantar and dorsum. Now, can you please tell me what is the nerve coming from behind? The nerve coming from behind will be tibial nerve, and tibial nerve will take a turn and enter into plantar region. And in the plantar region, it is dividing into medial plantar and lateral plantar. I repeat again, tibial nerve will take a turn and enter into plantar region, dividing into medial plantar, lateral plantar, and that will supply to all the muscles of foot. All the muscles of foot are supplied by lateral and medial plantar nerve. And this lateral and medial plantar nerve are a branch of tibial nerve. Lateral plantar nerve and the medial plantar nerve are a branch of tibial nerve. Is it okay? And that is taking care of all the muscles of foot, guys. This is like the golden rule that you have to remember here. Done. And madam, your answer here, sciatic nerve is not supplying to any muscles and all. I told you already, sciatic nerve is made up of two nerves, tibial nerve and common peroneal nerve. So whatever tibial nerve you are seeing here, it is a component of sciatic only. And whatever these branches you are seeing, it is also a component of sciatic only. So we don't say directly like sciatic nerve is supplying, it is the component of sciatic nerve supplying. So let us just revise this once more here right now, guys. Yes, thigh here is divided into three compartments: anterior, posterior, and medial. Anterior, posterior, and the medial. Anterior compartment of the thigh will be supplied by femoral nerve. Medial compartment of the thigh will be supplied by obturator nerve, and the posterior compartment of the thigh by tibial nerve. Anterior compartment of the thigh will be by femoral, medial compartment will be by obturator, and posterior compartment tibial. In the leg, anterior compartment is by deep peroneal, lateral compartment is by superficial peroneal, and posterior compartment tibial. And all the muscles of foot will be supplied by medial plantar and lateral plantar. Are you comfortable? Good. Now once you are done with this one here right now, guys, so we'll stop it here right now. This is all the conceptual part of the lower limb part, and after this we need to learn about all the 5 major nerves one by one, and all that nerves with their muscles, it will be like, you know, a little bit like more complicated thing. So let us do that tomorrow. Fine. So that's all for today. We'll stop the class here. Good night.